on YouTube Live with our with the one and only Dr. Dress. Thank you so much for being here.
Thank you, Gigi, for the invite.
And I'm sorry, go ahead.
No, absolutely.
And one of the things that I first wanted to start with is today's a very special day for us here in the United States, and even more special for us here at Avana because Dr. Dress is a veteran, and I wanted to thank him for his service. So happy Veterans Day, and thank you.
Thank you very much.
Now, I wanted to take this opportunity to ask you how you got into the Air Force.
Well, my parents worked in Saudi Arabia as oil workers, and that's where I went to school from kindergarten through 9th grade. But after 9th grade, you have to go somewhere. Long story short, I was in the end of my high school, beginning of my college career when Saudi Arabia was invaded by Saddam Hussein, along with Kuwait. And the United States military came in literally within 2 weeks and secured the airspace, secured the ground, and then began a year-long buildup before the first Gulf War. So I felt like I had some sort of mission, some sort of responsibility to give back to not only the United States military, but to my own family who persevered, still trying to work through that whole thing. It was during my last 2 years of college that I was also trying to find some way to pay for medical school. And so when the recruiters came around, I was like, wow, this kills two birds with one stone.
Mm-hmm. Absolutely.
And there it goes.
And how did you get into the Air Force since there's so many options for you?
So they all came around and they all made offers of different types, but the Air Force was committed to allowing you to complete your entire desired specialty in training. In the Army and in the Navy, you had to serve as a general practitioner in most cases, either on board a ship or out in the field for several years before you got to come back and do your residency. So for me, two of my grandparents were also in the Army Air Corps, so for those reasons, it was kind of a natural progression.
You had flying in your veins.
I guess.
Okay, very good. And then you took advantage of what they were able to offer you to finish your medical school and your training. Can you go into a little bit about that for our viewers who may not know much about you? Can you go into how you got your medical training?
So you do your medical education at a 4-year medical college, and ours was the ones I got into basically were all 4-year institutions in the South. The one that I got accepted to that was local was the University of Tennessee College of Medicine in Memphis. And so after you complete your 4 years of training in medical college school, you have to go off and do a residency in a specialty.
And you had been to Miami before you started working with us, right?
Yes, I had,
okay.
Absolutely. I had done my medical rotations in the military during the very short summers you get in medical school, but I was scooped up by the Air Force to do an Air Force active duty residency in general surgery. And I was initially somewhat disappointed, but I was also given opportunities I would never have had before. Many things my civilian colleagues would never get to do in those situations, such as I got to spend several months in Peru doing surgery with active duty Air Force surgeons there as part of medical missionary work.
Is that where you learned your Spanish?
Part of it, yes ma'am.
Because he speaks Spanish very, very well.
And then during that time, I realized that plastic surgery is exactly what I wanted to do, and what the ability to be able to fix someone's life overnight through either fixing a cleft lip or cleft palate, or a burn scar contracture that made an arm unusable is suddenly usable again. And I was instantly hooked. And the Air Force then let me come down to Miami for my official plastic surgery residency. And so after completing the 2 residencies, I went back to an Air Force hospital up in the Panhandle of Florida, where I basically completed my active duty time and ultimately retired.
And that's amazing. You have dedicated your life to serving others, serving your country and serving your patients. And I just want to thank you on behalf of our patients, and again, on behalf of our country. Happy Veterans Day, and thank you for your service.
Thank you very much. I appreciate that.
So now we're going to go into speaking about our procedures. This is a wonderful opportunity for you to have a completely free consultation with the surgeon of your choice. This is a great opportunity for you to get to know Dr. Dress, and he's going to be able to answer a lot of the questions that you may have about the procedure that you're thinking about getting done. Now, to be able to ask questions on our chat, you have to subscribe to our channel. So make sure you subscribe. It's a wonderful way for you to be in the know of all of the videos that we upload, any information that you may need before your surgery, for post-op, any tips, and also our wonderful chats with our surgeons. Today we're here with our board-certified plastic surgeon, Dr. Dress, and it's an honor to answer all of your questions. So let's get right into it.
Very good.
A couple of days ago, we asked some of you to also let us know what procedures, what questions you had, and some of our patients had questions about breast implants.
Okay.
Now, I have a breast implant here. This is a silicone breast implant.
Yes.
And the other day while I was at the office, I was walking by and you were having a consult with a patient. And I see you opening the door and closing the door on this. It was amazing.
I did not know you were out there.
Oh, I was there. I was there.
I love it.
And I loved it because it's a fantastic way for you to tell our patients how safe and how durable these are. Do you want to go into it a little bit?
Sure, absolutely. So the initial silicone gel implants were also developed back in the 60s and 70s and even early 80s, along with implants made of all different types of other materials, including acrylics and polyacrylamide gels and other things that we found out are not safe whatsoever. The original implants had a very porous outer shell that allowed some of the uncross-linked silicone to get out of it. And so if you set this down on a surface, it would actually leave an oily type residue. Well, that can't be good for anybody.
Right.
And we knew when the FDA took these off the market in 1992 that the science and the construction of these had to be better. Well, they've been darn well perfected since then. Now the shell incorporates a bleed barrier, and the silicone is so highly cross-linked that there's really no free molecular silicone left in it. The ones that came out back on the market in 2006 were what we call the third generation or highly cohesive gels, and since then we now have gels that maintain their shape even if you cut the caps, the outer shell.
Which is also known the gummy bear.
Colloquially are called the gummy bears because if you cut them in half, nothing falls out of them. There's no liquid type state in them. And therefore, if there is a crack in the shell, nothing spills out of it. There's nothing to really cause an autoimmune response to the patient. We don't get capsular contractures like we used to see with the older type implants. And so these things are so strong. I used to demonstrate with a golf club or by slamming it in the door. I still do that. This one's been slammed in the door to the exam room at least 1,000 times. And it's still intact, it's still holding its shape. I doubt you're going to slam your breast into a car door or an office door, but in case you were to have some physical trauma to the breast, such as a seatbelt injury from a car accident, then you can be assured that the chances of that thing being injured are very, very low. The rupture rate on them is way lower than even the saline counterparts, and the data shows that these are as safe, if not safer, than saline.
Right, which a lot of people didn't know.
But did not know.
So I actually have even stepped on this with very large spiky heels just to test it out. And you can get a pair of scissors and try to stab it and it will not break. So it's incredibly, incredibly safe. It's very cohesive and it's a wonderful patient option. Now, do you want to talk to us a little bit about how it feels?
So yeah, there's no comparison between the bag of water that a saline implant is and today's modern, highly cohesive and cross-linked gels. It feels natural. It feels like a breast of a human being. There's, the only tissue that might feel more realistic is, your own tissue transplanted from elsewhere. So in this case, especially in a patient that doesn't have a lot of breast tissue to begin with, this is the most natural looking and feeling. Now we only have the round ones, but even when you hold them up, you can see that they take on a teardrop shape, and that's what they'll do in your own body and in your own breast tissue envelope. We more often than not put them inside or underneath the pectoralis muscles, and that gives them kind of more room to sit more naturally. But there are some patients that actually get a better look and result going on top of the muscle, depending on if there's any even early drooping of the breast skin envelope.
Okay, and let's debunk a myth. Some patients think that if you have an implant in, you cannot breastfeed.
So yeah, I've seen them both on top and underneath the pec muscles, and very, 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 very rarely is there a problem breastfeeding. My wife was able to breastfeed effortlessly with these implants, and I think that most patients would be able to. You go under the muscle, you're not interrupting any continuity
Right.
Of the hormones and blood supply from the hypothalamus in the back of the brain to the breast.
Right, and that's a very important thing for our patients to know, because a lot of patients have that question. I mean, I've been working in this industry since 2015, and I still had that question. I had a breast augmentation in 2019. 2021, I got pregnant, and I wondered about it, and I had no problems whatsoever when my son arrived last year. So not to fear, this does not get in the way of being able to produce enough of your milk. So thank you so much for clarifying that for our patients.
Absolutely.
Some patients actually have a question about using your own fat for a breast augmentation. Now I know that that's not ideal for many patients. Who is it ideal for?
So the patient who has already had a situation where their skin has been expanded is a good candidate, because the fat injections into the breast aren't going to be able to expand the breast skin envelope like an implant. But if you had larger breasts during pregnancy and during breastfeeding and lost some or all of your volume afterwards, the placement of your own fat in careful planes during the injection process will give a very natural look and feel, and it's your own living tissue. There's nothing to get infected, rejected, to have to potentially replace down the road. And because it's fat, if you gain weight, the breast will gain weight even more than they perhaps used to. And if you lose a lot of weight, then you're going to probably lose that fat as well.
Exactly. So you have to make sure that you are in a stable weight, if that's something that you want to consider. And also, if you don't want to gain 3 or 4 cup sizes, you don't want a very dramatic breast aug, right?
Right. Yeah. I tell patients generally a half to 1 cup is what can be achieved with your own fat.
Okay, fantastic, and thank you for that. Now, let's have a little conversation about things you wish patients knew. If there could be one thing you wish patients all around knew, what would it be?
Well, Hollywood is good at creating myths. And of course, many of us watch TV and stream when we go home from a long day. And one very, very common myth that I have to debunk when I see patients is the ability to do cosmetic surgery or plastic surgery in general without creating scars. It's impossible. If you cut through skin in an adult, you're going to create a scar. And that scar, can be cleverly hidden or disguised in body folds and natural creases. And that's where plastic surgeons get a lot of our training, is how to create scars that are going to blend in with the surrounding tissue and not stick out like a sore thumb from across the parking lot.
Right. And I think there's another aspect to it where I think us as patients should embrace scars. I think it's a roadmap of your life and your journey. Just as
kind of like tattoos,
just
right?
like
Yeah,
tattoos,
absolutely.
and just like, for example, women's C-section scar.
Yes.
That's my favorite scar on my body, and I've had plenty of surgeries, but that's the scar that has given me the most beautiful story of my life. And that's the way that we should see our breast augmentation scars, or breast lift scars, or our tummy tuck scars, because it really vastly improved your self-esteem, the way you see life, and just overall everything in your life. So embrace your scars. Know that you're not the only one that has them. Everyone has them, and wear them proudly.
And the vast majority of patients heal beautifully.
Absolutely.
Beautiful, beautiful scars that aren't going to create any issues down the road.
Absolutely. And now we actually have a patient, Ramona. Hi, Ramona. And she wanted to know if you should stop coffee before surgery.
Well, don't drink it the morning of, although having just had my 50-year-old screening colonoscopy, was told I could drink black coffee the morning of, but no sooner than 6 hours from anesthesia.
I'm shocked they would tell you that before a colonoscopy. That's a
Yeah,
very
yeah, that
daring
was it,
surgeon.
yeah. So, but we do tell patients that they can have sips of clear liquids the morning of.
Maybe
as
for
long-
medication.
Yeah, yes, exactly. Coffee is actually proven to extend your life. Every single study on coffee shows that it's beneficial, and it not only improves your ability to do complex calculations and problems and manage a complex schedule in your life, but it also extends your life.
Now that's amazing news for me, Doc, because ever since I became a mom, I live on coffee.
Perfect.
Every single morning I have to have my coffee on my way to work. Right before I leave the house, I refill it.
Absolutely. Yeah, the data actually says that up to 6 cups a day is actually more beneficial for you. So it's one of the few things where more is better. But I highly recommend, yes, you can't drink a big old mug of coffee with a lot of cream but right before surgery. But there's no reason when you get home from surgery that you can't have a big old cup of coffee.
And what about wine? What does the study say about wine?
So the studies are numerous, and they show that red wine, not white wine, not hard liquor, not beer, but red wine has been shown through the resveratrol chemical in the grape skin to basically do a number of things for our bodies. It directly lowers blood pressure, it directly lowers the bad cholesterol, and it raises the good cholesterol. In men especially, it increases the diameter of the blood vessels in the heart.
Wow, fantastic.
So it also improves sleep, and they say it also improves memory. Now, again, that's 1 to 2 glasses, 8-ounce glasses of wine a night, not the Magnum,
Not the whole bottle.
not the Magnum bottle by yourself. And in women, it's 1 glass a night.
Okay, fantastic news, Doc. So this was approved. This is technically a prescription, so I'm going to start on that today.
Perfect.
Thank you, doctor.
Perfect.
So now we're going to remind everybody that if you want to comment, please subscribe to our channel. This is a wonderful opportunity for you to have a consult with your favorite surgeon, with all of the surgeons here at Avana, so you can get to know each and every one of them before you come and visit us. Make sure you subscribe to our channel so that you can stay tuned to every single weekly live, as well as all of the posts that we post every single day. Thank you so much for joining us, and we're going to continue now with the section of our YouTube Live about pre-op requirements for surgery with you. Do you want to go into a little bit of what those requirements are?
Sure. So the general requirements are we want you to be healthy and feeling well. If you've got too much stress, I mean, if you've got a parent who's sick or a child who's sick or a job situation, this is not the time to have surgery. We've had some patients who were like, lost their job, then came down to have surgery. I'm like, maybe this isn't the best time for that type of situation. We know that depression and surgery don't mix.
Right, you want to have a clear head before going.
Absolutely. Depression will cause delayed healing or downright poor healing from a major operation. And so we never want to recommend somebody have any type of surgery in that type of situation. But we want you walking, if you can, whatever you can walk is better than no walking. So if you're able to walk, a couple miles a day, that's perfect. It improves your pulmonary function.
Better for anesthesia?
Absolutely. And it also improves on the backside, what you're able to do from oxygen and carbon dioxide exchange during, before, and after surgery. We want you to be eating at least 30% of your daily diet, and preferably even 40% as protein calories, because we don't need the carbs. there's absolutely no need in our bodies for carbs. Carbs are a relatively recent addition to the human diet. And farming, which makes the carbs, has only been around for the past 10 to 12,000 years. You need the protein and you need the fats. And with protein and fats, we can heal just about anything. But if you aren't eating it, you're not going to have it available to heal with.
Okay.
And we need to have those building blocks for our liver to be able to make not only the scar tissue to heal, but also to make the clotting factors to prevent us from bleeding when we have the surgical trauma. And also to be able to make, the necessary postoperative hormones and everything else that we have that binds those in our bloodstream.
And what are the most popular procedures today? What is it that you mostly see?
So it seems like my largest population is the very large-breasted ladies who are wanting a breast reduction. They're symptomatic. They're always having back and neck pain, grooving. Have to use powder underneath the breast or the blow dryer before putting on their blouses, and they're just miserable.
Yeah.
The large-breasted ladies, for the most part, are living in chronic pain. And when we operate on those patients, they float off the table. They are the happiest patient population in any surgical field I've ever come across.
That's amazing.
That's where I've, over the past 10 to 15 years, kind of put my efforts in, not only from a cosmetic standpoint, but also from a reconstructional and functional standpoint.
Okay. And we have a patient here who, Edleen, she's thinking of using Renuvion on her belly. Do you want to speak a little bit about whether that might be a good option for her and who's a good candidate?
Sure. So there are 3 relative skin types, and when we're talking about the liposuction and the tightening, and then adding in another modality to improve the skin envelope tightening, Renuvion, the technology we use, and that's the manufacturer, is J-Plasma. And J-Plasma is a thermal energy device that, once we've created space under the skin in the area of concern with liposuction, then we're able to open up the J-Plasma probe and get that entire machine turned on and warmed up. And it actually also uses argon to cool the tip of the probe so that we don't have a runaway thermal injury. But what it does do is it cross-links the proteins of the living layer of the skin, which is called the dermis. And it's a shiny white layer in all of us, and once we apply that heat to it, it tightens. And the best example I can give is it's like throwing a raw egg on a hot pan. It instantly goes from a gooey, clear, gelatinous to a firm white substance, and that's what this does. It may not do it instantly, but it does it relatively fast. And by relatively fast, I mean 6, 8, 12 weeks, things are really, really, really tightening beautifully. Now, some patients already have perfect skin.
Right.
And perfect skin can't be made any more perfect. So there's really little benefit to be gained by using J-Plasma in somebody who's already got tight skin. It's really, and then some patients have really, really, really bad skin, especially if you've seen patients with severe stretch marks going up and down the whole abdomen. Those are dermal scars that we're seeing through the epidermis, and that's already damaged dermis. So that is also a patient population that's not going to benefit. It's the patients who have regular stretch marks and who have stretched out skin from their pregnancies or their former shape that benefit the most. And that's probably the middle third of all the patients that we do that would benefit from the addition of J-Plasma. It gives about 50 to 100% more tightening than liposuction alone.
Which is incredibly impressive. Lipo alone, and correct me if I'm wrong, only really retracts the skin maximum 10%, which is not very much. And like you said, some patients need a lot more than that. And I'll go into a very quick personal story. Back in 2018, I had a gastric sleeve and I lost 120 pounds.
I love it.
but I didn't need a tummy tuck, or I didn't need a body lift. I didn't need a brachioplasty because my skin, luckily, is pretty good. But no skin can come out of that intact, you know.
Right.
At the time, we were able to introduce Renuvion over to our practice, and I was the first person, the first patient for Ivana that had Renuvion done on her, and I did it on my arms, and I did it on my abdomen along with liposuction, and believe it or not, ab etching.
Yeah.
And I was able to get ab etching. I was able to
Love it.
have abs after losing 120 pounds in
incredible.
10 months. That's amazing. That's unheard of. No one could tell that I had lost so much weight, and I really do attribute that not just to the talent of the surgeon, but to the technology behind Renuvion. It was simply mind-blowing, and the results, even now, 2022, I had this back in 2019, even now I can see those results.
I
Even
bet.
after having a child, I can see the results. My arms, I used to have bat wings. I don't have bat wings. My abdomen retracted beautifully after my pregnancy, and I had a big belly, if you don't remember. I mean, that was pretty big. I was wobbling around, Ivana.
You were beautiful.
Thank
Beautiful
you.
mother.
Thank you so much. And let me tell you, it retracted beautifully. And I was a little scared about that because losing 120 pounds and then a couple years later having a baby and not having the smallest belly, I was like, oh God, what am I doing? What have I done? And luckily my skin snapped back beautifully. So if this is something that you may want to add to your procedure, it might be the perfect thing for you. So this is a good opportunity to send us a message or call us at 305-501-6000 for a virtual consultation with the one and only Dr. Dress and see if that's something that might be right for you. And there's a patient, Sally. Hi, Sally.
Hey, Sally.
She has a question about her husband. She wants to know more about lipo for men.
Okay.
Can we go into a little bit about that?
So I would
What's the
say
BMI? What post-op care should men take?
sure. So men make up about 10% of our population, and liposuction is probably the most common thing we do
Yeah.
here for men. Absolutely. Although I've done several tummy tucks as well,
Mm-hmm.
and men have every right to have any of these operations that women have. The man shape, and a man can desire a more masculine shape or a more effeminate shape, and it works either way. You know, you just have to know where the patient's desire is and map accordingly when you're doing that. And we can add ab etching as well to further accentuate
Ooh.
the shape of a man, you know, which is typically kind of that triangular shape, and it's a different ab etching altogether than what we do for a lady. Now, with that said, men do need to wear the compression just like women. It may not be, you know, very comfortable, especially if they work in like an outside job or something like that. That could be problematic, especially during hot summer months, having to wear the garment, but that you lose the result. Now,
Absolutely.
men also have the same problems in not eating enough protein in the United States. All of us are, you know, really a kind of a carb addicted society. And so we have to educate everybody that we need to increase our protein and make sure that we've got enough to be healthy and to be able to heal and not have to rob protein from other parts of the body and other functions of the body.
You're getting me a little hungry. I want to sink my teeth
That's
into
it.
a nice filet mignon right now.
Nice. But also, you know, we have to kind of give men sterner warnings about not trying to go and start exercising or lifting too
Right.
soon. Most of us men think that we can be knocked down for just a few minutes and then we can go back to right way. No. We can't have any shearing of the skin over the liposuctioned areas. That will create fluid formation and also inflammatory products that could create, you know, delayed healing and even, you know, fluid collations that we have to drain.
Massages? They need massages as well?
Yeah, so massages are for opening the lymphatic channels earlier, and that works, men and women alike.
Okay.
Yes. yes.
So maybe if your husband had six-pack abs when you met him, and then after having babies, he gained a little bit of that pregnancy weight with you, because you know that
Absolutely.
happens.
Oh, yeah.
It's not just the woman that gains the weight, the man does too. I've seen it as well. And then maybe those six-pack abs turned into a little beer belly. This might be a good thing for you. It might be a good thing for your husband to come in and get a consult with Dr. Dress and see if liposuction might be good for him. Now, very quickly, in the beer belly thing, it sparked something in my mind. Tell us the difference between intra-abdominal fat and the fat that we can remove with liposuction, and how can you
Absolutely.
tell at home?
So there's a layer of fat around all of our intestines that we call the intra-abdominal or visceral fat. That layer of fat can be very dense, and it can be extremely helpful in keeping us from going through starvation states and dying from not eating for several weeks. It's the first fat that's burned off if we go into, a diet and exercise plan. You lose the visceral fat first, and that's why you might be losing inches on the belt. You might be losing pounds on the scale, but you look in the mirror and you're like, God, I look the same. I've lost 8 pounds and I'm one notch tighter on my belt. Why don't I look any different? And it's because of the visceral fat that's been lost. But the extra abdominal fat, all the fat that hangs off of us, that's between the muscle and the skin, love handles and side boobs and everything else, that is fat that can be removed safely with liposuction. We can't touch the visceral fat. We can only get the fat that's outside our core muscles. And that's the fat that luckily makes the biggest difference on how we look.
And if you can pinch the fat, that's the fat we can remove.
We can suck it.
Okay, very good. Now, I wanted to take this opportunity to also let you all know who's the winner of our $500 giveaway. This is a giveaway that we did 2 weeks ago.
Perfect.
For everybody that was commenting, the first 50 comments on our YouTube Live 2 weeks ago, they were entered into a raffle, and we were able to pick out a winner who's going to be credited with $500 here at Avana Plastic Surgery for a procedure of your choice, and her name is Miss Lizzie 03. So congratulations, Miss Lizzie.
All right.
If you are seeing this now, please send us a DM on our Instagram or call us at 305-501-6000. You can also, like I said, send us a direct message on Instagram at our Avana Plastic Surgery web profile page. Miss Lizzie 03, congratulations. Now, I want to take again this opportunity to thank Dr. Dress for his time.
Thank you.
And I want to thank you from the bottom of my heart and on behalf of the company. Happy Veterans Day.
Thank you, Gigi.
We really value you and everything you've done for us here.
And thank you guys for taking care of me.
Absolutely. Our pleasure for many more years to come.
I hope so.
Thank you so much for taking the time to be with us. I look forward to seeing you all next week. Stay tuned for more information on that. Have a wonderful weekend, everybody.
Happy Veterans Day.
Happy Veterans Day.